I truly believe there should always be something experimental in any program. And now we come to that final portion of our program, where we are going to have Emorn put all of you on the spot. So I hope you're feeling a little uncomfortable. First, she's going to be asking our speakers, our distinguished guests that we began with, she's going to be turning to them and asking them to commit to one thing that they will each do differently in response to the Global Nutrition Report and those extraordinary findings that Lawrence presented. And then she's going to be turning to you and asking you to stand up. You're self-selecting, we're not going to be calling on anyone, to stand up and talk about what you and your organisation, so please state who you are and where you're from, could take on to help implement this very, very important report. And I would ask you, when you're thinking about this, to heed the words of the Global Nutrition Report and be breathtakingly ambitious in your ideas. So over to you, Emorn.
We have not won the war on malnutrition in all its forms. And people say to me that there has to be small battles that need to be won before that. This is where I will come to you. Where are those battles that we have to win before we get there? It's an interesting thing, and I would like to ask for just for a few minutes of thinking, and just to say, how many of you here think you belong directly to nutrition community, that your work, your responsibility are directly nutrition oriented? How many of you here? Can you show hand? Okay. Thank you for being here. You are the game changer. You're the one we count on you to go out there and be able to. And how many of you cares about nutrition? You are not directly in nutrition community, but you are interested, you're concerned, you want to do something about it. How many? Welcome and thank you. We need more of you. The goal of Global Nutrition Report, and one of them, is that we would like to see this second audience growing, reaching out. We want to reach the non-nutrition crowd, to those who can really make it. So I would like to then, first, I think, to ask our invited speaker about what they would like to do. And you know, that's something that reminds me, and I'm just trying not to joke here, but when we talk about fighting the war on malnutrition, it always brings to my mind about the action-oriented. We need Fast and Furious 8. No, the Fast and Furious 7. And you talk about those action-oriented. I mean, I really think we really have to get there. That kind of a mindset that we have to be the Fast and Furious too, to tackle malnutrition. So I would like to get the comments, and starting off with the Minister of Finance from Indonesia. So, Your Excellency, can you say something about what do you think Indonesia would be taking on as a priority and in the next coming year to be able to address malnutrition in Indonesia?
Yes, I think no. I think nutrition is it is a very important. If I'm a Minister of Health, not the financing, Okay, and then yes, medical is only the 30% for backup for the people. The first is nutrition, and then the second is we need the clean water, and then we need the a good environment, and then the medical backup is only 30% if the nutrition it can be solved from us. Yes, I think I'm thinking about nutrition is a very important. And then now with the climate change, we must thinking it's more difficult in this time for the global. But I think like Indonesia is a tropical country. I think Indonesia is a very rich for the nutrition for the people, but in the fact, how can the people still in the malnutrition and now increase the obesity? Maybe this is the attitude of the people and the attitude of all of us as a yes, I think as a government or as a pemimpin. Yes, that's I think we must change the mind of the government, the mind of the people.
Thank you. In the ASEAN economic community, we look up to Indonesia. If Indonesia has made that commitment, it's very serious as part of a ASEAN, that this is a model, and it's encouraged other countries to follow suit. Thank you very much for your commitment and the priority of nutrition in Indonesia. I'd like to come to you, Mrs. Graça Machel, about what you would like to take on in the coming year as, yes.
Well, as the Graça Machel Trust, we will work with our partners in selected countries to develop social pacts to translate into strong alliances at national and community level so that nutritious food is available and affordable for all, leading to change of eating habits in selected countries.
Thank you. That sounds good. And yes, that's very encouraging. And if you will forgive me, I will go lady first, and then we'll come to you and the viewer. So, Joint, could you please?
I'm a traditionalist, and I can't talk to you with my back to you. That's what my mother taught me. We have been working with 25 African countries on maternal, newborn, and child health scorecards as a management tool and action trackers. We have been working with partners here, some partners here, WHO, UNICEF, etc. And we are actually going to hand this work over the coming year to the regional office in WHO. So what I can commit to is to work with these countries and the regional office to strengthen the nutrition component, to bring in some of the very excellent issues that have been raised in this report on the multi-sectorality of it, particularly the broad political engagement. Broad, I mean bringing in regional institutions, not just the country level institutions. Because we have been we traditionally work with the country level institutions, but bringing in the regional institutions, and then also working with partners here like SAN and others whom we have been partnering with in I think in a pilot that we did in Tanzania, to actually come up with a strong community accountability tool. I think we need to develop a strong tool that is at community level that can help people understand what nutrition is all about, not just using the indicators that are recommended by WHO, but getting community level indicators that are relevant to the foods and the nutritional needs of their own people, and trying to develop a tool like that that can these countries can use. But again, all I'll commit to is to working with partners to do this, and hopefully over the coming year, our nutrition leaders here will be able to lead us to really have an effective accountability tool, because I think that is what we need. Thank you.
Thank you very much. Thank you.
So there are two things that I just want to talk about. One is that there are 7,000 community health workers working for the International Rescue Committee in 35 countries around the world, and these are the fragile states that I spoke about earlier, and they're going to be absolutely key to developing and testing this combined protocol that we're working on with Action Against Hunger, Action contre la faim. And I very much hope to be able to have really high levels of transparency with the GNR authors and their teams to show the power of this combined protocol. But I'm afraid I have to also say that as a result of this meeting, I have a second task over the next year. And without wishing to in any way colour the outcome of this meeting, I have to say I'm rather surprised that I have this task. And the task is to be on Lawrence's case in a really big way in the next year. Because I said to him, not in jest, that I was surprised that in his 9 or 10 aspects of his call to action, people living in conflict states weren't mentioned. I said it in seriousness. Okay. Because 43% of the world's extreme poor live in conflict states. I don't feel I'm representing a vested interest in saying that for them not to get a mention in a report of this substance and this importance is, at its absolute minimum, a failure of advocacy on my part. And if in a year's time, Lawrence is still telling me that not only do the people who live in conflict states not deserve a chapter, but don't deserve a mention, then I think that will be a terrifying commentary on the degree of dialogue and the degree of commitment to break down a divide between humanitarian and development action that lots of people talk about, and which actually more of us have the power to do something about than is actually done. So that is my second task.
The GNR team will also have to make some of the commitment in that, but we take that seriously as well into consideration. It was in our dialogue. We have been discussing that. So may I turn to you for...
Okay, thanks very much. I don't know which way to go because I'll have my back somewhere. So sorry, David. But I'll say I'll be looking at doing 3 things, and I'll look at it on a time frame. Time frame 1 will be over the next few weeks, and that it's going to be about getting nutrition and its place within the SDG and Agenda 2030. And we definitely, within World Food Programme, are pushing for making sure that we get nutrition and nutrition-sensitive indicators well in to be well mentioned there. And as you've said, it's over the next few weeks. So over the next few weeks, I mean, we have been working on this, and it's something I'll push for over the next few weeks. Over the next year, I'll be joining David in his advocacy role. So, Lawrence, you'll have both of us on your case about getting that. And I know Lawrence's reply, David, is going to be that we should write the chapter. But certainly that's the next year. And then over time, because this is something that we are doing and we need to do short-term, long-term, everything, will be the whole area of nutrition and getting it right, especially for those that we serve, is about doing it in partnership. One of our biggest and strongest partners, UNICEF, was sat here, but it's that commitment on partnership. And in our specific case, and we're glad to see them mentioned in the report, is about the first 1,000 days. And we know that to get that done right, that's really where it's the broad sector of partnership, and we'll absolutely commit to that. Thank you.
Thank you. Thank you for that. And now I turn to you among the audience as to what do you think you can commit to? Yes, thank you. One first, and I see many hands. Wow, now that's neat. Okay.
I'm also worried about which way to turn. Excuse me, Mrs. Michelle. I'm Robin Gorner. I'm the Executive Director of the Partnership for Maternal, Newborn, Child and Child Health. We're going to make 3 commitments. One is that under the new global strategy for women's, children's and adolescents' health, we're charged with the Unified Accountability Mechanism. So we pledge to work with Lawrence and with the broader nutrition movement, because the SDGs oblige us to work across sectors, as we've heard. And so as we develop that accountability mechanism, we'll work across sectors. Secondly, I pledge to work towards as impressive an accountability report as we've seen here today, and to work alongside the points that Joy has raised about it being a people-led movement. And thirdly, I'm also going to stand with David Miliband, because as you heard in the opening remarks from Mrs. Michelle, there's also a deeply inequitable impact of maternal and child mortality in conflict-affected areas. And that's why the new global strategy is every woman, every child, every adolescent, everywhere.
Thank you. Wow. Now that's so encouraging. All right, more commitment. Yes. I will have to in the middle. Yes. Augustin, you have your.
Hi, I don't know also where to look.
More
so
funding, more funding.
a little bit in the front, a little bit in the back.
Sorry.
I mean, I think a lot of the call to actions resonate very strongly with us, but I'll just pick 3 things. The first one is about N4G commitments. We, as a co-host of N4G, I mean, we strongly buy into the value of the commitments and the accountability mechanism, and we will, hold our commitments, but also will kind of work with a lot of partners, try to get more commitments and commitments from new partners. And I think it's really important next year in Rio, there's an opportunity to make new commitments and to report on existing commitments, and we should all do that. The second one is on getting more nutrition for the money, which I think is really important. We talk a lot about new resources, but also we need to improve efficiencies. And so we're working and we're committing to work hard with partners again, to reduce the cost of the community management of acute malnutrition by 2. So either through product innovations or service delivery innovations. And the third one, which I want to mention because it gets a mention in the report, but doesn't get enough mention elsewhere, is about coverage. We need to measure coverage much better, and we at SAFE will be investing a lot in measuring coverage in the future.
Thank you very much. We took note of all of this, partly to track the commitment of today too. So, yes, please.
Great. I'm Kate Gertson with the Action Global Health Partnership. And as Augustin has alluded to, we're interested in committing to follow up on the Nutrition for Growth commitments and to work with governments on what they can do in Rio in terms of new pledges, including new money on the table. So you'll see on the table outside, there's the new Nutrition for Growth donor scorecard, where we've taken one step in that direction, and we're looking forward to working with all of you on that.
Thank you very much. I see UNICEF would like to make a commitment, right? Okay. And Peru, then we'll come to you.
Thank you very much. We very much want to make a commitment first to continue to work to improve data on nutrition related to children. Second, to support nutrition programming in over 70 countries across a variety of contexts, including fragile and emergency contexts. And thirdly, as the organization focused on children that works in a number of sectors, to take steps so that our programming in WASH, ECD, social protection, and health is nutrition sensitive, and supports nutrition-sensitive programming at country level. Thank you.
Thank you. Farouk, you next, and then do I see, okay, Mark? Yes. Okay, we'll come to you. Please be brief, Farouk. Right there.
In terms of country commitment, I just want to everybody know that Ethiopia recently made a commitment, and this commitment is called the Sekota Declaration, which declares to end child undernutrition in Ethiopia by 2030. And this commitment is serious, and the government is investing in 8 components, which have at least 6 or 5 sectors. I think some of our partners here were there. And we want to transform lives of the society and poverty reduction through as an entry point using nutrition. And for this, the Prime Minister as well as the 11 presidents, regional presidents have signed to it to put money and make themselves accountable. And in terms of accountability and data, we think that the community will be a judge of that. Thank you.
Woo, wow, very good. Wow, that's neat. Very encouraging. So, Mark? Ken will put more money, right, into. We need support. Yes, please. Country.
Thanks. Well, I'd like to commit to work with the partners who just came together, almost 500 in Arusha, to sign the Arusha Declaration to finish scaling up food fortification in another 25 countries to reduce micronutrient deficiency. So this is really a commitment to take that agenda forward with with the SAN and all the UN partners and all the other stakeholders. Thank you.
Thank you. Okay. We have the lady, and then, oh yes, and then you can come after, and
Okay.
then we'll come to you. 1 minute. Okay, please.
Felicity Ukoko from the Wellbeing Foundation, Africa. I'm just going to reiterate what Lawrence said about data collection being a very big issue. Sorry, can you hear me?
Yes.
Data collection being a very big issue. You said if you don't know where you're going, you don't know what you're doing. And I think at Wellbeing Foundation, we have developed a tool, a personal health record tool that every woman should have from pregnancy. It captures all the key indicators around breastfeeding from the minute the baby is born, within the first hour, and you can monitor breastfeeding up to 2 years. We have a tool, and we commit to ensure that every woman in Nigeria and across Africa should have a personal health record that would help us to capture the data and be able to monitor and know what we're doing. Thank you.
Thank you. Please.
Thank you. Katie Dane, Executive Director of the NCD Alliance. I'll keep mine short. I think as an organisation of 2,000 organisations in 170 countries focused on NCD prevention and control, we can commit to working across the civil society nutrition space, as we did so effectively last year in the lead up to the second International Conference on Nutrition, ICN2. There's obviously a great deal of opportunity to be working across the whole of malnutrition, as the GNL report highlights. And 2 particular opportunities that we'll really focus on is obviously implementation of the ICN2 Rome Declaration and the framework for action, but also the Decade of Action for Nutrition, which is currently being discussed and is obviously up to all of us in this room to really galvanise around and make the Decade of Action have an impact.
Thank you very much. Now that's good. Yes, I think it's important that gentleman's been waiting for a long time. Are you from country? Yes, please.
Thank you so much.
We
I commit to using the report to inspire political leadership towards addressing nutrition issues, so that we can foster accountability.
Thank you. Yes, the power of nutrition. Yes, and then
Last one.
Yeah.
Right, okay, thank you. Gosh.
No pressure then. My name is Martin Short from the Power of Nutrition. The provision of nutrition seems to me to be the pathway out of poverty. We have the data to back that up. And yet, when I look at the other end of the scale and I see the amount of money that is dedicated towards that aim from an ODA basis, there's a chronic lack of funding and there's a great gap. I then look at the SDG goals and I think to myself that none of them actually are going to work unless we deal with nutrition. So there is a disconnect between the data, the amount of funding, and the ambition. The Power of Nutrition is an organization or charitable foundation that is dedicated towards and will, over the course of the next number of years, raise significant money for the provision of nutrition for interventions within 5 to 10 target countries. That number should be, and we aim to release in the order of $1 billion. That'll become over a course of a number of years because this is, and dedicated towards, a business that is really in prevention because there is no cure. And we want to get to those people, those children and those mothers in the first 1,000 days to ensure that we can actually change their lives, because once you've given them their 4 centimeters and once you've given them that cognitive ability, that can never be taken away. Thank you.
Thank you. And thank you very much. I know all of you have in your mind the commitment of what to do. Thank you very much. I applaud that. And in the coming year, please, we will follow up on all those commitments. Thank you for your commitment and for participation.